My name is Brian Gonzalez, and this is Anatomy and Physiology. This is going to be the dissection of the chicken wing. So I have my chicken wing here. I couldn't find the actual like wing, but I'm still gonna explain it in thorough. I really hope that I don't get docked for any points because of this, but I'm gonna try my best to say this. So I do have my tweezers here. I also have my scalpel, and then I have my little scissors for cutting. I have my gloves. I have paper towels here for needed, and the raw chicken uncooked. So some of the basic things I'm gonna talk about the chicken wing is, if you're looking at it from the wing, it's gonna be from the joints, the muscles, tendons, ligaments, and then you can tell the bone. Um, so pretty much the muscles are gonna be soft and like kind of red tissues. Those are the parts that will help like with movement, like the wing that's like up and down. The tendons will be the white like cords. Um, it's gonna be like muscles that are stuck to the bone. The ligaments are gonna be small tissues that connect bones to other bones, I guess you can say. So the next thing is I'm gonna look at the chicken. So the upper wing is literally gonna be the shoulder part of it. So that would be this part. If you're looking at it from this standpoint, so that would be the wing that picks up. The lower wing will be like the forearm part of this, and then the wing tip, it'd be like the little flap that you would see right there, and that would be like kind of like the hand, I guess you can say. Um, so the first thing that I'm gonna do is I'm gonna remove the skin. Either you can use, I'm gonna try like my scissors or my scalpel. I'm just gonna cut around the skin, making sure that I'm not cutting to myself. Just being very gentle because the scalpel is very sharp. I'm gonna get my tweezers. I'm gonna see if I can pick this up. Okay, I'm gonna gently pull back. So I dissected a little piece of the skin right here, and you can kind of see that the skin, it's like a little red, stretchy, like it's very like stretchy. Um, you can like notice how the muscle, the wing can move, like, so I'm gonna pull it, and then you can kind of see the skin of it. That part, so the tendons will be kind of, I'm gonna cut a little bit deeper so you can see the tendons. Trying not to cut myself. Okay, so I pulled back, and if you can see the tendons right there. And then if you look a little bit closer, I'm gonna see if I can expose the bone a little bit more. And then as you can see right here, a little bit of blood. You can see the bone showing. So that would be the bone that's connected to it. I don't know if I can get the bone marrow on this one. Yeah, but the bone marrow would basically just be that white, like, it should be like a gelatin type of texture. That should be on the bone. Yeah, so basically for the wing, it would just be the wing that's moving up and down. You would just tell by the shoulder blades. The middle would be like the forearm of it, and then the end, you would tell that little flap that would be like the hand. But yeah, so all together you can see the little veins. You can kind of push the blood a little bit, and you can see it going through the little vein. The cartilage, the bone that's there, and then like I said earlier, the skin, like you can tell that the chicken, it's like chicken skin, so you can tell the texture is like very like bumpy where the feathers used to be, so that part would be poking out. So that's my dissection of the chicken wing. I hope you enjoyed it. Thank you.